Dear Kenyans, COVID-19 is real. COVID-19 strips families of the dignity of a proper burial, the dignity of closure, the dignity of touching their loved ones. For those of us who come from areas where we have a very close relationship with our departed ones when it comes to mourning them, COVID-19 strips people of all this. I visited with the family, and one of the children asked me, would my mother have died if she wasn't a doctor? Did she have to go and attend to patients that day?
All right, that is Dr. Wala, who was mourning the death of Dr. Doreen Lugaliki, who passed on Friday. She becomes the first medical doctor to die in the line of duty. And of course, we are told that she died of the coronavirus pandemic or the coronavirus disease. And today is her funeral day. She'll be buried in Bungoma. And joining us this morning, two leaders of the unions of the healthcare workers. We have Dr. Chibanzi Mwachonda, who is the acting Secretary General of the KMPDU. We also have Alfred, who is the president of the the National Association of Nurses in Kenya. Good morning, both of you. And let's begin with you, Dr. Mwachonda, because I know you're on the road heading to Bungoma for the funeral of your colleague, Dr. Lugaliki. What is the mood? How would you describe the mood in the vehicle as you head towards Bungoma for the final rites of the late Daktari?
Yeah, good morning, Sam, and thank you. I think it's quite, I'd say, a coincidence, because even when I received the news on Friday, I was actually traveling. I think we were going to distribute PPEs in Coast. And then today, I find myself also traveling to go for the final send-off. So it's quite sad and it's quite a somber mood. I think when you're traveling, you always have this where you keep thinking about what exactly has happened, the magnitude of it, and basically that's the mood, and those are the thoughts running through. That myself being a doctor and the other doctors who we've spoken, who have really been crying, some have really been crying over and over, especially those who are very close to her. The mourning is actually very real amongst the doctors.
Right, and of course our condolences go to you and the community of doctors that as you head to the funeral. I want us to listen to what Alfred had to say in as far as some of the nurses that have lost their lives. If we have that ready to listen to what he spoke about, talking about two nurses who have died so far. Let's listen in.
We've lost two nurses. One, Layford Mburia, a nurse anesthetist who was working at Kitengela Medical Hospital, Kitengela. We lost Moses Gitonga Ringera, a nurse who was working with the University of Nairobi Health Center. When you talk about the PPEs, and not just PPEs, but quality PPEs, not substandard PPEs, this is what we mean. There's a surging infection rate amongst the health workers. We've now started to experience deaths. We don't wish to have more deaths, but it may happen if we don't take action.
All right, and Alfred Obengo is the president of the National Nurses Association of Kenya. He's still on the line. Good morning, Alfred. And so, yes, you spoke about two nurses that have already died. Yesterday, we saw the numbers that so far 417 health workers have contracted the virus. Would you know the circumstances? Have all of them contracted the disease while in line of duty, or there are some that have been exposed elsewhere?
Good morning, Sam. According to us, we will say that they have contracted the disease while in the line of duty, because that is where we spend most of our time. I can tell you so far we have one nurse in Kitui, one nurse in Bagadi, 5 nurses in Machakos, 1 nurse in Homa Bay, 3 in Kiambu, 7 in Nairobi and KNH, and 2 in Moranga. There are several also that have been told who have contracted disease, around 4 in Mombasa. So you can see the numbers, and actually they are increasing. And even as this disease, the pandemic broke out in Kenya, we started by telling the authorities that they need to take very, very measurable precautionary measures so that we protect our frontline health warriors. This is a song that we've sung all through. Now the whole nation, the whole healthcare fraternity is in a somber mood. Actually, Mburia, we lost Mburia on 18th of last month, and Moses Gitonga on 25th also of May. But you know, during that time, there was still the lockdown of traveling, so we could not have really joined our colleagues in laying our frontline heroes to rest. Yeah.
Right, and I heard you yesterday, or the day before yesterday, speaking about the quality of PPEs that the medical or healthcare workers are having to put on. Do you have any issues with the quality that you've been receiving that you think would actually be compromising the safety of healthcare workers?
I have evidence. I've been by people have shared with me photos of the quality of the substandard PPEs that they've received, to the extent that it even gets torn before you start to work. Some even get torn in the process of donning them. So you can see the magnitude of the problem you're having. And you have also said that you'd rather even have no PPE than don a PPE that is substandard, because it gives you just psychological protection.
Right, and Dr. Chibanzi, so yes, there are those concerns about the personal protective equipment that you have to wear. For yourself, do you have any concerns? Do the doctor have any concerns on what they are wearing? And would you have any evidence that because of the poor quality, some of them have gotten exposed to the extent that now 417 people have contracted the virus?
Yeah, so Sam, the first thing is to agree with the sentiments of my colleague Alfred. But also equally is to say that for us, we really thank the Kenya COVID Fund that has worked with us to ensure that we get quality PPEs and meet standards through the end user verification and through bringing us on board as a technical advisory team to the health committee of the fund. So as far as PPEs are concerned and standards, yes, through the Kenya COVID Fund, we have assurance of quality, but you know that is focused more on the designated COVID-19 facilities across the country. So still you do have counties procuring PPEs through their own procurement channels. You still have local manufacturers who are making substandard PPEs. So the issue here really is that fact that there has to be stringent measures put in place to ensure the regulation of the supply and procurement of PPEs. It must be from the 7 factories that we ourselves have visited through the COVID Fund and certified that they actually meet the standards as part of end user verification. So that is how we will resolve this matter. But if we let procurement, the measures in terms of the procurement of PPEs to be open without further regulation, then we will of course see more healthcare workers contracting due to the substandard PPEs in circulation.
Right. Of course, we'll continue to monitor that as you raise concerns about the quality of the protective equipment. But the other issues that you've been facing, and there's specific concerns about what President Kenyatta a while back announced, that there will be a welfare package to be worked on by the Public Service Ministry as well as the Ministry of Health. We were told that some money was released. And even when he spoke to the Council of Governors chairperson last week, he told us that there's some money that has been released to the counties. Are you saying that so far nobody has received anything from that welfare package?
Yeah, so first is to thank the President for his concern and his efforts towards making sure that healthcare workers actually are well taken care of, and that is why he gave the directive. So the first one was the welfare package, which was basically an incentive. I think SRC approved these allowances as enhanced risk allowances for the various cadres in the health sector. They are yet to be paid, but what we've seen and what we know is that we've seen a release of a schedule of release of monies by the Ministry of Health to each specific county, basically for that. So we do anticipate that by end of this month, which is now July, that the monies will be paid to all healthcare personnel for the last 3 months. Now, the other issue here, the other directive that was given was the issue of insurance and compensation. And remember, and you asked the question to my colleague Alfred regards to the community, widespread community spread of the disease. Remember, and that is why we have the Occupational Safety and Health Act 2007, that in such a scenario where healthcare workers are in the highest, in a very high-risk environment, despite the fact that you have community, then it is deemed as work-related exposure, and so the infections should be deemed as work-related, and that is as per the law. So with regards to that, there's of course the issue of treatment of healthcare workers, facilities set aside for treatment specifically for healthcare workers, and then thirdly, compensation, which is also in law. And in case of a mortality, which is very unfortunate, like the situation you're currently in, there has to be some compensation because remember, these are the frontline soldiers in the country. Right, so and that is yet to be unveiled, and we hope we've made the appeal, and we hope that it will be addressed soon as possible.
All right, I'll get to you, Alfred, shortly, but let's listen first to some of you when you spoke on Saturday about these concerns on the kitty for the healthcare workers.
Frontline workers need to be assured that their safety is paramount as they offer their services.
It does injure the morale, and this is because, as a doctor, it could have been any one of us. As we speak now, we are not sure. We're not assured of our treatment. We're not assured of care of our loved ones.
This is a demand because it's a right that the frontline soldiers be protected when they are fighting this COVID-19. And if it is not implemented, then the healthcare workers will seek further options on how they can protect themselves, including staying in their own houses.
As the numbers rise, of course, the number of healthcare workers that will be exposed will equally rise. But we'll continue to support the healthcare workers through the insurance cover that the government provides, through psychosocial support, and through any means possible at the disposal of the government.
All right, so that's Dr. Amoth. He's the Director General of the Ministry of Health, and he's saying that psychosocial support will continue. The insurance cover that the government has provided will continue. I don't know how much of this, Alfred, you're receiving or your colleagues are receiving, bearing in mind that, yes, the disease continues, the risk is there that some may get infected. How much of support are you receiving, and especially for those that have already been infected?
First, it is laughable. It is laughable that we talked about a welfare package, and yet now we have 3 colleagues who have gone down, our heroes who have gone down with the disease without actually even putting their hands on the welfare package. It is laughable. So it is something that needed to be expedited. We needed to have been implemented early enough, because we are aware that even the resources that were allocated to the economic stimulus package that was announced by the president have already been released. So we are wondering why, for the health workers, it's taking this long, and yet now the numbers of infections are surging amongst the health workers, and we are also starting to have deaths amongst the health workers. So are we waiting for the health workers to die so that we pay them? That's a bit unreasonable. In terms of psychosocial support, yeah, it has been there, but actually now we've organized a system whereby we, the health workers, are going to respond to the distress calls from our own colleagues by establishing a call center, which we are working with the Kenya Medical Association, KMPDU, with my brother, Dr. Chibanzi, the clinical officers, and all the entire healthcare professional, so that we respond to our own distress calls. But insofar as the stigma is concerned within the healthcare system, it is real, and we also want to appeal to also our colleagues to treat fairly and with compassion especially our staff who are on the who are working directly with the COVID patients, so that stigma enhanced. So we need to change also our communication mechanism on how we communicate to health workers. This is not the time to give the orders like we used to give, because these people are already undergoing a lot of mental and physical stress because of this disease. And it's not, we've been having a staff that is a healthcare staff that is understaffed, is undertrained, and is under-equipped. And the question has actually been aggravated now with the COVID pandemic. So we need to be very, very considerate, compassionate to our healthcare frontline warriors.
Okay, I'll get back to that, but let's first listen to that message by Dr. Wala, who spoke on, I believe it was on Saturday, talking about the final message of Dr. Lugaliki, who, like I said, the funeral is scheduled to happen today in Bungoma late in the or early afternoon.
On Wednesday this week, she wrote us a message, her last message, which was, "The soldier has fallen." Dr. Adisa got a diagnosis of COVID-19 this week. She was previously very well. I was informed shortly after that she was admitted into ICU, and she succumbed to COVID-19 on the morning of Friday.
We have many soldiers in the front line, and the majority of those soldiers, if you look in the entire health system, the composition will be women.
All right, and of course, yes, now she passed on, but she was at the Aga Khan University Hospital here in Nairobi. I'm just wondering, where are these others admitted? Because the total is 417 infections as of yesterday. 3 have died, so you have about 414. Where are they admitted, if you know, Alfred or Dr. Let me start with you, Alfred.
Come again?
I'm asking, now that we know Dr. Lugaliki died at the Aga Khan University Hospital here in Nairobi, where are the others and where are they admitted? Because the number would be 414 that remain with the virus or have gone through the virus.
Most of the health facilities are actually, and most of the counties are admitting the healthcare as their own jurisdiction and facilities. Remember that when we started this war, there was a ward that was specifically designed for the healthcare workers at Kenyatta National Hospital, and it's still there. And actually, I've been told that that facility has been very, very busy. But ideally, we should have special units and facilities to cater for the healthcare workers, just in appreciation to the kind of work they are doing today, so that we treat them with a lot of dignity. We give them the psychosocial support that they need during the period when they are sick. And most importantly, it must be a wholesome approach, whereby you also take care of their families and their friends.
Okay, all right. And Dr. Chibanzi, so now, because we know you are talking of the situation that they are not being, or Alfred talks about they are not receiving the support that was promised. What do you think is the desired situation, even as we have these special units being set aside for healthcare workers?
Yeah, so first and foremost is that the Ministry of Health needs to take this issue very seriously and approach it from a point of occupational safety and health. And once we agree on that, then we put in place mechanisms to ensure that healthcare workers will be compensated, will go through the process of notification of disease and contact once one contracts the disease. Because I know a good number of them, including my personal friends, who stayed home. Yes, they are deemed to be asymptomatic, but there's a very increasing evidence of COVID-19, the virus, SARS-CoV-2, affecting many other systems in the body. The heart, the brain, the abdominal system. And I think there's one popular personality, Richard Quest from CNN, who wrote last week how even after he was deemed negative. He was deemed to have recovered. He was experiencing CNS symptoms, some sluggish. And so this is disability that is setting in. So at this point, the disease is very new, and so we do not know what will be the long-term complications, what other complications will come, even after you have labeled the healthcare workers to have recovered from the illness. So that is another mechanism. So with that, you put in place that we get the compensation for the healthcare workers, employ more healthcare workers. It's been 3 months now. So you have more infected going under quarantine, they infect their colleagues. So you basically have burdened the current healthcare workers on the ground. And this situation cannot and shall not continue this way.
Right, and of course we have been told that the numbers will keep rising. Currently we have 10,000 infections across the country, and with the phased reopening starting, whose effects start to kick in this week. So there's that expectation that these numbers will continue to rise. What do you think is the right thing to happen in the coming days when the threat of infection is even higher now, Alfred?
One thing, there's a message I want to send very strongly, especially to the county governments and the governors, insofar as that is concerned. They have been displaying and splashing well-painted isolation facilities and actually celebrating them in the media. Yet, we are not seeing the health personnel who is going to work in those facilities. They have been talking about, I have now 10 beds, I have now 12 beds ICU, I have 5 beds ICU, I am prepared. And yet we know they don't even have the right personnel to manage those ICUs. They don't have the anesthetist, they don't have the nurse anesthetist, they don't have the clinical officer anesthetist, they don't have the ICU nurses, well-trained. And when you talk about ICU nurses, we are talking about nurses who are trained for 1 year, not 1 month. So we need also to invest heavily on the issue of human resource, not just physical infrastructure that we are seeing today.
But Alfred, the Council of Governors chairperson who spoke on Wednesday last week said that as of that week, more than 8,000 healthcare workers had been trained with the coronavirus disease. They had been sensitized. Are you telling me that this information is not correct? Are your colleagues not well versed with what to expect when they get to the front line?
The training has been going on, but rather slowly. We all know that. And from the statistics and the reports that we are getting also from our people across the country, is that probably almost just half have been trained. And for now, they have concentrated on training on the health personnel around those isolation facilities. But we want the training to be spread across the country, even in facilities that actually are not admitting COVID, because COVID is not just concentrated in those isolation facilities. You can get COVID patients even in other hospitals now before you take them to the isolation facilities. So we need to intensify the training and cover all health workers, not just the ones working in those isolation facilities. Though they had to prioritize, we agree, and they had to start from somewhere. But we need to escalate and that training so that we cover all healthcare workers. Training is very, very critical in case management and even the donning of PPEs. Because if you are not well trained in the donning of PPEs and you are giving the same PPEs, it will not help you, because there's a lot of exposure and infection exposure when you are donning and you are doffing the PPEs. So that training is very critical. And one thing also I wanted to mention about the quality of PPEs that also been explained well by my brother, Dr. Machonda, is that we need to distinguish between the PPEs that the COVID fund and the healthcare workers actually and the process of procuring and distributing, and the PPEs that were procured separately and independently by the health facilities and county governments. For now, the PPEs that we procured through the COVID fund, we've gone through the quality control measures, and we are certain we've been reassured of their quality standards. But we have a situation whereby the PPEs that had been procured independently by the county governments and other health facilities through their normal procurement system are very, very substandard. And we wish to strongly send a message that when you are doing procurement of PPEs, let the end users be part of that technical evaluation team, not just some procurement officers sitting somewhere and procuring what they don't even know about.
Okay, all right. And Dr. Mwachonda, your final thoughts even as you head to the funeral of Dr. Doreen Lugaliki. Of course, Kenyans are looking up to you because you are the frontline soldiers. But now when you bleed, the rest of the country also bleeds. How much confident should we be at a time you have to bid goodbye to one of your own?
It's a tough situation, Sam. In reality, we are human, even as much as we are healthcare personnel, we are professionals in the healthcare sector, and it hurts more when it's one of you. Of course, every death hurts, even of that of a patient, because then now you have that connection with patients. So essentially, we require support. Support from Kenyans is to make sure that you please adhere to the guidelines that have been set and the mitigation measures in place. Put on your masks, wash your hands, avoid gatherings, and stay home and only come out when necessary. Support from the government. Support from the government is employ more healthcare personnel, pay them well, give them very good terms and conditions of work, ensure that they are safe at the workplace, occupational safety and health. And lastly, put in place the compensation mechanisms, even for those who will not have died, but who we have to monitor for the next 2 to 3 years because of perhaps the long-term complications of the disease that are not yet, haven't revealed themselves in full, but that might lead to disability. And that is the support that the government needs to give us. And if we're given all the support, Kenyans support us, the government supports us, we will deliver this for you.
All right. Thank you so much. Dr. Mwachonda, just where are you now?
I'm on the road. Don't worry.
What particular place?
Somewhere in Naivasha.
Okay, somewhere in Naivasha. Wish you all the best in your journey as you travel to Bungoma to bid farewell to Dr. Doreen Lugaliki, and of course our condolences to the family and the fraternity. Thank you both, Alfred and Dr. Mwachonda, there for speaking to us. Yes, Alfred, quickly.
One second. On the terms of employment, we need to be very, very considerate and very serious within the terms of employment that we're employing the health workers. We have employers who are employing health workers currently, nurses, doctors, even without risk allowance or health medical coverage. That's a very, very serious anomaly that needs to be addressed. So when we are employing our staff, our healthcare staff, let us also employ them in employment terms that actually are civilized, not primitive. Thank you.
Thank you so much. Alfred Obengo is the president of the National Association of Nurses of Kenya. Thank you for speaking to us, as well as Dr. Mwachonda. As I said, he is heading to the funeral of Dr. Lugaliki in Bungoma. We take a short break. On return, we'll be putting the numbers into perspective, even as we prepare to speak to the Vice Chancellor of the University of Nairobi, Professor Stephen Kiama Gitahi, will be speaking to us about learning anew on how to deliver content in the universities. We have that conversation after the break.